Hi everyone, this is Dr. Rambabu, MD General Medicine, Consultant Physician in Balaji Multispecialty Hospital, Sillur, Madurai. Hypertension. See, hypertension is the most commonly you have all heard about it, but few only know about what are the causes for elevated this hypertension, blood pressure, or any decreased cause of blood pressure. Let me see what is hypertension. So, hypertension is defined as any blood pressure more than 140 by 90 mm of Hg is known as hypertension. See, hypertension is of two types: primary hypertension and secondary hypertension. See, primary hypertensions are 85% of cases of primary hypertension, where the cause is not known. Whereas secondary hypertension is of around 10 to 15% of cases where they are due to some other secondary causes. This why we have to give importance to this hypertension, because hypertension is a patient will not have any symptoms. They will be diagnosed suddenly, or they will be diagnosed when they are presenting with some other complaints. It is like a silent killer. Why we have to give importance to this hypertension? Because due to hypertension, there will be complications like MI, like stroke, vascular disorders, and renal failure. So we have to identify this hypertension in the early stages, and we have to treat the hypertension adequately. So let me go into the causes for this elevated blood pressure. Some most common cause like poor diet. So if our diet consisting of salt or processed food or unhealthy fat, what happens here is, if you have diet has consist of more of salt has capacity of absorbing more fluid. So when there is a more salt in our body, it absorbs more fluid. So automatically the blood vessels will be consist of more fluid, which will cause increase in the blood pressure. One thing. Second factor, due to age. In elderly patients, there is a loss of elasticity of the blood vessels. So there will be stiffness of the blood vessel will be seen. So there will be increase in elevated blood pressure in elderly patients. So elderly patients compulsorily they have to check their BP regularly. Next, we have like alcohol, smoking. The smoking has the effect on the blood vessels. They make the blood vessels will be injured, and there will be causes atherosclerosis, and they will cause loss of the elastic activity. Next, lack of physical inactivity. So when there is a due to most common, this is one of the main factor where due to this sedentary lifestyles, there is an increasing of overweight, and there will be insulin resistance, and there will be increased activity of sympathetic overactivity, where there will be increase in heart rate and increasing the vascular tone, leading to the blood pressure. And there will be genetic factors which should be run in our families. So fathers having hypertension, maybe the children will be also have the hypertension. So along these genetic factors, if they have any sedentary lifestyles, they will be precipitate and they will be present with hypertension in early stages. Second factors like a renal failure. So why kidneys are involved in this hypertension? Because the blood pressure is maintained by the balance of fluid in our body. So the kidneys maintain this balance. So when the kidneys have lost this balance, automatically blood pressure will not be maintained. So patient will have blood pressure. So these are the some of the causes where you will have elevated blood pressure. Let me see into the what are the causes of hypotension, where the patient will have low blood pressure less than 90 by 60. So when the patient have low blood pressure, they will be presented with the complaints of dizziness, tiredness, or syncope complaints. So what are the most common cause is dehydration. So during the summer time, where we all live in a agriculture background families, all agricultural laborers, they will work in a hot summer. So due to this excessive hot exposure, they will have sweating, loss of fluid. So there will cause a loss of fluid in our blood also. So automatically there will be drop in our blood pressure. So we have to take adequate fluid during when you are working in the hot temperature. Second thing, if there is a blood loss, so during any trauma, any accidents, there will be loss of blood that will lead to the hypertension. Next is some endocrine causes, hypothyroidism, Cushing Addison disease is also leads to the hypertension. Second most important thing is patients who are already known hypertension patients are on the treatment. If they are using more than one drug, so when there is a combination of drugs are used for the hypertension treatment, they should be observed their BP regularly because there is a risk of hypertension will be seen. And the patient is having any sepsis or infection, there will be leads to the systemic vasodilation. So there will be loss of fluid and there will be lead to the hypertension. So hypertension also we have to identify by the symptoms like dizziness, tiredness. So any patient, if you have complaints of either elevated blood pressure or hypertension, you have to go to a nearby hospital and get treated from your nearby doctor. How we will manage hypertension? So first thing in management of hypertension is diet. You have to keep your diet like with consist of low salt intake and should be low carbohydrate. You have to consist of more proteins and a low fat. Second thing, you have to regular physical exercise should be done for minimum of 5 days in a week for minimum of 30 minutes. And we have to get consultant from the near doctor and you have to start anti-hypertension medications. Because hypertension has a very high risk complications, we have to prevent it before itself. Thank you.